When I was talking about the various layers of sclera, I told you that lamina fusca and choroid, the area between them, that is called the suprachoroidal region. So if this is my choroid and this is my sclera, if we get massive bleeding in this region, that I call it as a suprachoroidal hemorrhage. Now, what is the significance of suprachoroidal hemorrhage? So first is where it occurs. So most commonly it happens during intraocular surgery. Let's say I am doing a cataract surgery, and in between a cataract surgery, what happens is I feel that all the intraocular contents, the aqueous, the vitreous and the lens, they are coming from the main incision. So there is some pressure which is happening in the inside of the eyeball, which is causing all the intraocular contents to go from the main incision. Let's say this is my main incision. So there is an expulsive hemorrhage through the main incision. Now, why it happens? The basic pathology is that there is a bursting of or hemorrhage in the suprachoroidal space cause of bursting of the ciliary vessels. We have long or short posteriorly ciliary arteries here. So hemorrhaging is due to bursting of ciliary vessels, and this happens because of most commonly sudden decompression. So the pressure, let's say, is 45 millimeter of mercury, and from 45 millimeter of mercury it suddenly goes to 5 millimeter of mercury. So there is a sudden change of intraocular pressure that causes this bursting of ciliary vessels. So this is one hypothesis, and they sometimes ask what are the risk factors. So the risk factors, the most common is, as I told you, there is a high intraocular pressure. Patient on, already there is a predisposition that these vessels are very weak. So the patients on various anticoagulants, having uncontrolled hypertension, and patient having a advanced age, let's say patient at 85-90 years of age. So how they would ask a question? They would ask a question that the patient is a 90-year-old male with uncontrolled hypertension with glaucoma, has been taken into a cataract surgery, and during cataract surgery what happened is there is an expulsive hemorrhage. What are the vessels that are basically damaged? So your answer would be the damage is there on the short or long ciliary vessels, or they can ask what is the diagnosis here. Diagnosis here is suprachoroidal hemorrhage. Now, one word regarding its management. You have to just postpone your surgery, and wherever your main incision is, you put strong non-absorbable sutures there. So the intraocular contents, they do not get expulsed, and then later stage, when you have all these factors that are controlled, then you can go for your complete surgery. But at this point of time, you just have to close the eye, otherwise everything would be lost.